Channel 4, where local news comes first.
Yeah, some brand new statistics show how serious the smoking problem is outstate. Our Good Health reporter Lila Lazarus is here now with more on what's being done about it. Lila?
Well, Ruth, Devin, this is one of those good news, bad news stories. The good news is the number of smokers in Michigan has decreased as people age. But the bad news is we still have an awful lot of smokers. And who's the typical Michigan smoker? Well, typically it's a man, a baby boomer, who's likely divorced.
How many don't feel like being hooked, a slave to cigarettes, controlled by this habit?
These people want to quit smoking for good.
You know it's possible to do. You're not the person in the block to kick the habit.
They attended this session of talk and hypnosis at St. John Hospital today to save thousands of dollars and add years to their lives. But just minutes into the session, 47-year-old David Baxter headed outside for what he insists is his last cigarette. How bad do you want to quit?
Real bad. It's time to do it now. People my age are just dropping heart attacks every day, and it's just had enough.
He's been smoking 25 years, a pack a day.
2 in the middle of the night, 1 in the morning, 1 on the way to work, 1 on every break, 1 on the way home, and 1 before I go to bed, just about every time of the day.
Cigarette breaks were just built into his workday.
4 or 5 extra breaks. I hope my boss doesn't see that.
David isn't alone. A survey released today showed a sizable amount of Michiganders' time and money is going up in smoke.
The message to Michiganders is to quit and keep quitting. That the most important thing that comes out of this survey to me is a decision to quit.
Smokers spend an average 39 minutes a day on smoke breaks, taking 3 smoke breaks each day at 13 minutes apiece. So health systems like St. John are not only trying to get people to quit, but also prevent younger people from starting.
Prevention really is the key.
Tonight, at least one Michigander says he's kicked it for good.
That's it, baby.
That's the last one, he says. We just called, David. He says he's now gone 4 hours and he hasn't touched a cigarette. You can do it, David. Keep going. Besides health issues, think of the money. If the average employee makes $13 an hour, Michigan employers spend $1.7 billion on employee smoke breaks. For more information on St. John's Smoke Cessation Clinic, you can check out our website at WDIV.com.